let's talk about bleeding. Oh, we are on part 3. Let's talk about bleeding and infection. At the end, we'll discuss when you may want to call the doctor about what's going on with the umbilical cord. First, let's talk about bleeding. So prior to your baby being born, your baby was attached to the placenta by the umbilical cord. Now the baby comes out, the cord is cut, and we have old blood trapped in that cord and it has to go somewhere. So the way I like to think about it is, let's say you're having a milkshake, that wonderful chocolate milkshake, and you sip on that milkshake and there is chocolate left in that straw. Well, guess what? There's blood left in that umbilical cord and it needs to go somewhere. I used to, all the time in the office, pick up the little baby, hold it against me, and I get a little dot on my shirt, and it's because that cord was draining right onto my shirt. So I stopped picking up the babies that way, but that doesn't stop the fact that blood is still going to be coming out of your baby a little bit. So how long is that blood going to seep from that umbilical cord? Well, that can be maybe 1 week after that cord falls off, up to 2, usually not too long. A little bit of blood is okay. Now, if there's tons of blood, if you really see a lot, if we're bleeding profusely, that's another story that becomes more of a medical emergency. Why can that happen? Multiple reasons. Maybe we have an attachment still to a blood vessel inside your baby that we have to be concerned about. Maybe there's a bleeding order in the baby that we never realized to begin with. For whatever reason, there really shouldn't be tons of blood, and if there is, you need to call the doctor right away for that. There are also infections that can happen at the area. One is called funicitis. Don't ask me who named it. There's nothing fun about the fact that the area gets really stinky. Basically, when I talked about in part 2 cleaning the base with rubbing alcohol, it's to help treat what we call funicitis, which is drainage that's smelly, that's stinky, the skin is a little bit pink, and basically that can lead to more serious infections, and that's why I'm big on cleaning the base of the umbilical cord. If that infection progresses and the skin around there becomes really red and pussy and potentially feverish, then we have something called umbilitis, which is not a Dr. Seuss character. It's a very serious condition, and this needs medical treatment right away, and this is something that you should be aware of. So when is it that you need to call your baby's doctor? If we have umbilitis or redness around the skin, pus coming out of the area, a lot of bleeding, if you go to touch the umbilical cord region and your baby is extremely fussy and cries a bit, all of these are reasons why we need more immediate medical attention. Keep in mind that although bleeding and infection can happen at the umbilical cord, it's very uncommon. Once that umbilical cord falls off, everything should look normal in the area. If you do see a little bit of a bump or a mass over there, that's another condition that we'll talk about in part 4. Your shares are appreciated, and it's time for a chocolate milkshake.